All right, now on to our Health Watch, where we talk about all the topics that are trending in the medical world. And as always, we're joined by Dr. Syed Hussain of Trinity Health of New England, joining us by Zoom. Doctor, good morning to you. How are you?
Good morning. Happy New Year, Tim.
And Happy New Year to you. We want to start with the FDA evaluating some reports of side effects like hair loss and suicidal thoughts in people taking weight loss medications like Ozempic, Mounjaro, and Wegovy. It's creating a bit of concern about the use of these drugs, as we've talked about them a lot. So what should we know about this medication?
Yeah, so let me try to explain what is happening here. So you'll remember December 2020, when we first started getting approval for COVID-19 vaccines, Pfizer, Moderna, there was a very vast safety net put in place by the CDC called the Vaccine Adverse Event Reporting System, which was able to detect a needle in a haystack safety event. So similarly, the FDA has a monitoring mechanism called the FDA Adverse Event Reporting System, whereby any adverse events related to new medications in particular, but also existing medications that have gotten approval, if folks start developing side effects that were not picked up in clinical studies or trials, then the FDA will start investigating, looking at whether there needs to be some sort of corrective action plan, whether there needs to be a new labeled warning related to these side effects. So suffice to say, it's still early days, but the FDA will be looking at reports of hair loss, of heightened suicidal ideation in some patients on these drugs. So it's still early, Tim, but it's something that the FDA is looking at currently.
Okay, moving on to respiratory viruses. Once again, 'tis the season after all those holiday gatherings wrapped up. Correct me if I'm wrong. I think last time I checked in Connecticut, COVID cases going up, flu cases going way up. RSV cases might be going down a little bit, but they're there. What should parents know to keep their kids safe and to help their child should they catch one of those viruses?
Yeah, we're still not out of the woods yet. We know winter is still ahead of us. We still have 8 to 12 weeks. So it's important we stick to those tried and tested infection control measures that have always worked. Hand washing, isolating or staying indoors when someone is sick, avoiding large crowds. There are a rash of new medications and vaccines now available. Over the last 12 months, there's been a lot of progress when it comes to fighting RSV. But, if you are pregnant or have a newborn, then it's important you reach out to your physician to talk about what those treatment options are, in addition to taking, like I said, the infection prevention measures that are common sense and they work really well.
Yes, and as you're saying this, I know you can't see it. We're showing video of kids wiping their noses and then touching their faces. Get those hands washed. That is always a big one. Lastly, very curious to know what you think about this. Johns Hopkins University released a study saying that if you can restore hearing loss with hearing aids, that can actually help people to live longer. What's the connection here?
Yeah, there's not a causal relationship yet, Tim, but am I surprised? No, because we know what happens to people with hearing loss. There's social isolation, there's cognitive impairment, there's a whole host of issues that accompany hearing loss. We have 40 million people in the U.S. that have hearing loss of some degree. Only 12% use hearing aids consistently. So it just goes on to show the immense benefits of having using a hearing aid and then using it consistently, more importantly.
Well, there you go. All right. So it is not necessarily causative at this point, just a correlation, but it would make sense.
That's right.
And quality of life counts for something
Absolutely.
as well. Excellent.
That's right. Absolutely.
Thank you so much. Dr. Syed Hussain from Trinity Health of New England. We always appreciate the knowledge. We'll see you again next week.
Thank you very much.